Start with a very gentle cleanser, something that says it's for sensitive skin. Perhaps one that contains glycerin, hyaluronic acid, or ceramides. Patients with rosacea tend to have very sensitive skin. They complain that it's very hard to find products, whether moisturizers, sunblocks, or cleansers, that don't sting or burn or make their face feel red. Start with a very gentle cleanser, something that says it's for sensitive skin. Perhaps one that contains glycerin, hyaluronic acid, or ceramides. That will definitely help to keep the skin from getting aggravated. Then use a bland moisturizer. Moisturizers including hyaluronic acid, glycerin, and ceramides are helpful, as are those containing some antioxidants. Green tea, niacinamide, vitamin E. These are all helpful ingredients for people with rosacea. There are also botanical ingredients like feverfew, which can be helpful to reduce some of the redness. Be sure to avoid some of the common products used for patients with plain acne vulgaris. Benzoyl peroxide and salicylic acid may irritate some rosacea patients.